pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Yeah, we was running late, sorry about that. It's a bad snowstorm. All right, welcome to the December 16th, 2020 meeting. Let the record show that all three commissioners are presently counted. Four here, and also Tammy is here, our auditor, so we appreciate her being here. And of course, Scoop is here, so we got the press here. Everything's rolling good. As normal, we do have a window of opportunity here for anybody that's not on the agenda that would like to bring up something, comments or questions, or throw rocks at either one of these two others is okay, just don't throw them at me. But anyway, now's your time to do that.
I've got a few things, but let the public go first.
Go ahead, Jeff.
I just have something I want to present to you guys. They came in there. It's a real token appreciation from the Moore Law Department.
Thank you, sir.
Well, thank you very much. We appreciate that.
I like that.
I do too. That County Emergency Communication. Thank you.
Appreciate it.
Thank you, thank you.
You know, the bag was coming.
Let's leave it in. Okay. I'm not. All right, anybody else? That's gonna be hard to top what he just did, but go ahead.
Yeah, we didn't know we were gonna bring his,
All right, John, go
I got
ahead.
the thing, unless one of you guys got something first.
No, I'm good, go on.
Okay, the museum. I got a couple things about down that. They ask us regularly, or every so often, to do some work down there. And we have our county highway go over and work back and forth. And they had some work they want done this week, and I don't think they're gonna have to do anything. But I talked to our attorney about it. We've been doing this for years, not a problem. But he thought we might ought to have some resolution or a agreement that we can work over there on their property, and they let us have all that parking over there. That's all that was. If anybody got an issue with that? We want to keep working with them, but it just makes it more legal.
No, I don't have a problem with it myself.
I don't have a problem with it, but I'd like to see, and a lot of people think the museum is county owned, and quite honestly, it ought to be. I think at the time that it kind of went that way, I think everybody kind of abandoned the building and was going to tear it down or whatever, and some people took an interest in it, and in turn, I think we just deeded it to them or whatever and said, here you go. But they're not on any tax roll from the county or anything. They're pretty much self-sufficient. I mean, I know we have gave them money in the past as a gift, but I'd like to see somehow, some way to, and I don't even know what their feelings are. This is just me talking, because if there's and John, I think you're on that board or whatever, but I think there's probably 24 people that if those people left this earth, that place would just close the doors and nothing would ever happen.
We had that discussion last meeting.
And that's a shame, because there's a lot of all Scott County histories in that building down there. And I would like to see, and I know we've discussed it over the years about how we can, get some tax dollars or do something, or I don't know if there's a probability of taking it back into the county, and so it is, that we can help. But our history's down there, and I really have, a sadness, I guess, if that ever happened, because if you never walked through there, and I know you do several times, and I have too, but it's gym that, you know, we kind of overlook and I'd like to see somehow, some way to fix the problem long-term so that once those people that are dedicated to it right now, you know, aren't around, that it's preserved. So whatever that is, I don't know what it is, but I know we've tried a few things and talked about a few things, and nothing's ever really rolled out concrete-wise, so.
I'm with you, I don't wanna lose our history, and there's so much down there I don't think people know about. What's the book the Genealogy Society has out now? All the death notices from all 1900s up to 1900. If anybody gets a chance to read that thing or buy a copy, $34 or something, it just astounds me, the stuff I didn't know. And I thought I knew a lot about our history, but when you get into that thing, you're gonna learn things that'll amaze you. So yeah, I would like to work some way towards making sure, whatever that may be, that we don't ever lose that someday. But on that, here's my second thing. We talked recently about our group got together about Pigeon Roost, that they doing something about the fence around there, and they had some things they were going to do, not necessarily the museum, just a group of people that are all associated with history in the museum. And I discussed at the last meeting, they were wanting to, Mr. Collins was down there, and he didn't think the whole fence was worth saving. He wanted to use parts of it we had and restore just the graveyard area, right beside the monument where the settlers are buried. And of course, they're wanting to take that stump there and have it, I don't even know how to call this, an actual tree stump there in the cemetery part that's, if I understand right, is direct lineage to the original tree that was there when they buried them or something. Anyway, so they had some things they wanted to do. It wasn't going to cost us nothing. They were asking the Tourism Visitors Commission for the money to do that. And was there anything else they were going to do there, Marty? Can you think of?
Oh, it's just a general cleanup. Now, they weren't
Yeah.
going, I don't believe they were gonna touch the monument itself, and the monument is stained because, of course, all those trees and everything else around there.
Yeah, and, yeah, there's a dozen things I got on my mind I wanna get done. I've asked the highway department already to look at taking that one tree down, we've talked about that. But regardless, what we're here for is to see, they're gonna meet with the Visitors Commission again, I think January 5th, see if they can get approval for the money. But they just need us to say yes or no on doing something with that fence around, Mr. Collins gonna do it, and making the stump kind of, I call it bronze, is that the word? They got somebody that's
Yeah,
gonna come and do
I
that.
have no idea what they got
Yeah,
in mind
but-
for that stuff.
That's just the group, if they wanna pay for it, it doesn't bother me none.
I thought we pretty well agreed.
Well, we talked about it, but we didn't agree to it. We talked, maybe somebody wanted to talk with Mary Beth or somebody, and so that's the only reason I'm bringing it up again. I think we had a general agreement, but didn't give the go-ahead.
Actually, I think what I said was that I think it's a good idea. I just wanted whatever their plan was to come back here prior to them, cutting a tree or knocking a fence down or whatever.
Yeah.
Want to know what their plan is instead of us just give them free will and they do whatever they want. So,
And they're not asking for any of that. All they're asking for right now is a fence and a stump, and I didn't think, there's some other stuff they're asking for, but it won't have anything to do with us down there. So, and if we decide, as a group and with them, which I kind of agree with you last meeting, I still kind of like to have some kind of fence around the monument.
Yeah.
And we can explore that and look into that and maybe ask Collins to look at that. But that's what they're asking for. And they were on talking about it on the phone a while ago, and I told them I'd try to get us a definite answer tonight. And I'm okay with it.
Yeah, I don't have a problem with it, what they do as long as, I'm like Mike, if they put it back in the original condition or try to do something with it like it was, then I'm okay with that. you know, I don't know how well the bonds and the stump's gonna work out, but I ain't paying for it. so,
They're
you know,
paying for it.
You know,
I've never seen one.
I have not,
Well,
you know, maybe that works, but I ain't following that thought plan, but, hey, if they wanna pay for it and try it, that's
Yeah.
okay, I don't have a problem with that, you know?
Let me go, okay, so is that a general agreement? I don't
Yeah,
think we can vote on
I
that.
think,
Yeah.
I think, you know, I think all of us is in agreement here that
Okay.
we're fine with it as long as it's, but I do think that, you know, I know they talked about, I guess, because some of the fences tore up, not being able to fence back off as much, you know, I would
We'll explore getting some new
explore,
fence
get
up
some
out
new
there.
fence, you know,
Yeah, I agree with
and,
that.
you know, and it may be as simple as,
You can get that aluminum fence pretty reasonable.
yeah, or, you know, I mean, yeah, you can,
I expect the
I'm
highway
sure
department
Mr. Collins could
Something,
come up with something, or, you know, and may go on, a person may go online and finds that, you know, for sale somewhere. You know, I remember, you know, the fence that's around, that used to be around the courthouse here is of course around Harrod Cemetery out there now. And, so, you know.
Right.
So, I mean, I
let me
don't know.
remember that, Marty.
I don't,
You're into this
There's
now,
some
big
out there
time, I'm
across
following
from-
your lead here.
There's
We
some
wanna
out
do-
there.
we wanna look at some
that
way to
lines
figure
that
out
front of that
fence-
house
keep
up there across
some
from
new
Wells
fence around the
feed
barn.
house.
Oh,
That guy owns that property in Texas.
yeah.
Did we agree, we talked about it just a minute ago, I'm going back again, did we agree to do some kind of resolution or something to allow our highway workers to work over there? I'm not talking about putting money into it, I'm talking about just physical work.
Yeah,
They've
And,
always been. able
they've
to do
always
that.
done
They
it.
have, but Bob felt like we probably ought to have something on paper, being we're on private property.
Okay.
Well, actually, don't we own that, or we're responsible for it now? So if we're responsible, county employees would be on it all they want.
I don't know. what we're
State turned it
responsible for.
over.
No, 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 I'm
Well,
sorry.
that's Pigeon Roost, he's talking about the,
I'm talking
the
about the
museum,
museum.
talking about the
Yeah.
museum, yeah.
Just need something on paper, if we ask them to go over and trim on a tree or something,
I think
can you ask Bob to like, or you, whatever,
I
an
can.
interlocal agreement or something. And I ain't done, guys, I'm still going around. We talked a while back about, and this may or not, it's been a month ago, about no hunting at the Gist property. Do we wanna pursue that, or keep exploring it, or forget about it for now, and look into it? I mean,
I don't really have a dog.
No, I don't, yeah, I don't either, really, you know, I guess.
if I was gonna do it, I'd just say no hunting. That's all the guy asked for, but we argued that.
Just a thought, should we check with our insurance carrier and ask what's the best posting for us to put on there for our liability? And just follow their advice and just push that up if that's what you guys agreed to.
So where'd the complaint come from?
A gentleman lived right on the edge of the property there. I've got his name, he said somebody there shooting and hunting or whatever and shot one of his cows.
They've hunted there as long as I've been alive.
Yeah,
Yeah, I'd like to say, I'd check with the insurance, and I think that would be the
Would
smart
that-
thing to do.
that'd be nice. I would
Yeah.
like to, I assume we're gonna have another meeting this year, maybe to get
That's
some
the
kind of an
end of
answer.
the
Yeah,
Okay,
the
good enough.
30th, I think.
I'll
or
try,
whatever.
I'm in touch with them right now because insurance renewal is gonna be on your 30th agenda.
Okay.
All right, I'm not done yet. I'll let you know, this might take a few minutes. Bear with me. Bear with me, but it's stuff we all need to know about.
Taking off after you.
A week ago,
Where's that egg timer?
actually, almost 2 weeks ago, I got called to the Findlay Fire Department from the firemen. They actually called me. A guy from IDM had been out there all quite upset. You guys, you know where we're going with this. Trash laying around, people dumping off stuff there before the time they're supposed to be there and all that. And of course, the fire department didn't want to take the hit for it, and they didn't. They're right. And the guy called me, and he said he's gonna send us a letter, and, he said, I don't wanna be a part of the problem, I wanna be a part of the solution, but there's certain things you gotta do. So I went out last Wednesday myself and sat there, and I got there at 2 o'clock, and there was already a bunch of trash there. Some of it had, well, the biggest part of it didn't even have stickers on it. And I did a little research, and it turns like there's some people coming over from Washington County dumping their stuff, this and that. And I'm sure I made about half a Leote Mac, that's turning people that way right and left. And I called the sheriff, he went out there, went through the trash, we got some names, we wanna notify them and all that kind of stuff. And, so I went back today, which I was late today because I was doing some other things. And now the sheriff had been out there earlier, but apparently they must have been there at 1 o'clock, somebody was out there dumping trash already. No stickers, no nothing. So not only they're violating our ordinances, they're costing us money. And, so I'm just letting you know that's going on. And the good news is Andrew's getting our cameras up. I think
They're,
well, I think he wasn't all, they're up, but I don't think they're all ready.
I think he's got them all ready but mine. But I haven't had any problems over where I'm at.
Yeah.
With that, I know before, the guy that does the pickup was dropping that garbage truck off there like the night before. So that, you know, like he was doing there by Stacy's,
Yeah.
he was leaving it, so if somebody did show up early, they were just throwing it in the back of the truck, but.
A problem come with that was the fact that there was a lot more trash showed up than they could throw in the back of that truck.
Yeah.
And so when he'd get there, it'd be piled up on the back, and the bottom line is, you know, this has been a problem, trash has been a problem, it always has been. But, you know, we went away from the bags, went to the stickers. The stickers was doing really well. I don't know how they're doing now, but they was doing really well, but, people, decided that they.
You can't get them to comply.
You can't get them to comply, and the only thing that gets somebody to comply is when you get in their pocketbook.
Well, that's why I called the sheriff.
And and until they put a camera up and until they issue some fines, I don't think it's ever gonna change. Or the only other alternative is to do away with it and just say, you know what, there's the landfill, but you're gonna see it scattered up and down your roads. So the only other alternative you got is put this on the tax roll and have countywide trash pickup. And that's probably gonna be an expensive venture.
Well,
So-
and I talked to several, I think these people, most of them are good people. They just think, oh, well, he'll be here after a while, we'll dump it and he'll pick it up. And there's also people just totally taking advantage of us. And, you know, of course, one guy says, well, I gotta be at work at 2, and I said, that's what we got the landfill for. And I wasn't trying to be rude, but I'm saying, I'm sorry, we've gotta put a stop to this. But like I say, my name didn't get thrown around in a very well manner that day probably. But, we're gonna get a letter, and the guy, when he called me, he said, I don't understand Scott County. I said, what do you mean? He says, you guys have more dump sites for the people than anywhere in the state.
Mhm.
And they said they still won't comply with it. So,
But the other part of that is that other counties don't have any type of, they do the recycling. But as far as the other trash, that's on the homeowner, whether they,
yeah,
you know, in the county, you can still burn some of it, and, I mean, some of you can't. But, cause I've asked them, I said, what do you guys do with trash? They can call one of the services that pick
Yeah.
up trash.
yeah.
So, but you also know, just like you said, you know, people aren't gonna do that. You know, I do a lot of riding and, you know, down Slab Road, they just throw it out in the ditch like they've done for I don't know how long.
Well, I think you've been really lucky. You got Troy Ponder.
Well, there's always been a camera there.
Yeah.
But I think that's
And
gonna
I
be.
have been down there, I've had to go down there and pick it up myself, cause it's thrown all over the baseball field.
And I'm gonna add a little bit more, just blame something else on COVID-19, but we've had a lot of people at home this year, and they've been cleaning, fixing stuff up, and our Ecotech haul-offs, lots of trash dumped out, yeah. So our trash system is really
Well, we probably got a lot of
falling short
yards
this year
cleaned up.
because we've had a lot of trash this year.
A lot of people cleaning up and cleaning out, so.
Well, I'm just letting everybody know what happened to me, so he writes, I assume he writes us all up,
Yeah.
but there's a letter coming.
Oh, it's coming to you.
Yeah, no, I asked him to send it to me, he said, no, it's gonna be ordered. So we're gonna blame the family, I reckon.
Lovely.
Well, let me go to my next item.
Okay.
I'm still rambling on here. Boatman Road, we talked about that last meeting too. About how we have the flooding and we put the gates up, they drove right through them. Well, I did a little research on that and turned out, the car, the sheriff did get called out there. And the car was towed into one of the places out there and there's a report written on it and there'll be some charges filed on the guy who destroyed it. It's a hit and run. He left the scene, didn't want to cooperate with the police at all. They called him, they finally got enough information that it's in the prosecutor's office. So I've asked for not only charges, but, be paid for our damages.
So he actually hit the gate.
He hit it,
Oh, I know it's tore
Yeah.
up, but I'm just
Yeah.
saying that,
But he has no insurance.
no insurance, no insurance.
there's
Who
no
knows,
charge.
and usually, I've been around before, and they hit and run, they don't see one, there may have been some other issues the guy had too, but I don't know about that, but, I've talked to the sheriff's office, prosecutor's office, and they're working on it, and they're gonna do what they gotta do. So, I think I'm done.
You've got 3 minutes left, that's all you got,
Actually,
Harold.
I'm not done.
Whip, there you go.
Yeah, where his.
Actually, I'm not done. Jill got us an ordinance for what they do in Jackson County on this kind of stuff, so we got a copy of that, we
On
wanna look at
the
it.
flood, driving through flood
Yeah,
stuff.
yeah. We
Well,
can look at that too.
I'm gonna bring it up, and I know he's, there's a fireman here from Austin Fire Department, I'm gonna ask him his thoughts, and I know what they are, because I've already had that conversation with them, but, there's been about putting the gate back up, not putting the gate up. That, where the gate's sitting is actually in the city limits, is that correct?
On the north end, yeah.
That, yeah, I know, it's on, that's what I'm saying, on that end, but I mean, as a fire department, because I said, on our end, as a fire department, I want them up. And if it's not a gate, maybe we put those concrete barriers up there and, we just leave them out there and put them in place if we're gonna shut it down, my whole thing about the gates are, and I know there's people that don't like it, but, my thing with the gate is that if we got them up, then use them. If we're using them in one place and we're not using them in another place that's flood prone, then I think we're doing a disservice. So I know, it is a pain and where when someone goes out there and gets hung up, and we've actually lost a couple people's lives.
Yes, we have.
And it's not worth it. I mean, they think they can do it, and it happens all over the country, but I mean, we have, I think, pretty much 2 areas that we're blocking off, and like I said, if we have to write an ordinance that says you go around this barrier, and of course, they're gonna be stuck out there, so, you get a ticket.
Well,
And
your
I know
point-
Jackson County does.
And I'm with your point too. We think about public safety on this, but this is emergency services safety.
Yeah.
If you guys are out there having to, I mean, the one we talked about, it was like 5 below zero, the one that we
I've
got
been in
out
a
there.
nice suit out there before.
And,
The one thing
so
that,
we gotta take care of our people too, I think.
the one thing that I remember, back and how the gates come about was the fact that, people were driving out through the water, getting flooded out, they'd have to go get them out, and we kept asking, why would you not ticket these people? And without any kind of barrier, they said they couldn't. So that was what that was originally done
Yeah.
for. And again, if they're gonna do that, it's just like this case here, again, they will be able to ticket this person or whatever they need to do.
I think
So-
that's what it all happens.
Well, in this case, there's some state charges.
And, so that's the reason the gates was there. So I guess, without some kind of barrier, whether it's a gate or it's putting the concrete, it's a lot to go out there and put the concrete up every time. So, without any kind of barrier, I don't think you'll have any legal leg to stand on about ticketing people or anything. So
The
you want
most
to keep that in
difficult part
mind.
for me is getting, our highway department has to make sure they're in contact with, James Township, make sure everybody coordinates. We can't lock one side off and not the other. But they do that, you guys do that,
We do a 30-day rotation.
okay,
They're
both sides.
responsible for both, this 30 days, we're responsible for both.
Okay.
And it goes to the on-call dispatch, so the dispatch knows whose turn it is.
So you're way ahead of me, good.
Well, and I understand, a lot of times, there's an expense for those gates. I mean, and somebody tears one up just like this guy did, they're not cheap. So,
I think we still got a hold on his car too.
well, it's probably not worth the gate.
I got a
But
picture of it.
anyway.
A
Anyway,
truck.
sorry, Kevin. But I did say that I thought you guys were in favor of the gates. and
As a
shutting.
fireman, I love the gate.
Yep,
They just need to be an ordinance.
as a county employment, you don't like the gate.
We've had sheriffs out there.
Yeah.
Because we hear
Oh,
complaints.
no, I'm on the long call, so I enjoy that
He
part too.
knows. Yeah,
So we just need to, we've been out there before and the sheriff's department be out there with us. But when we get the car out of the water, everybody leaves.
Oh, yeah.
There's no penalty.
Yeah, well, I remember the van of the two guys that couldn't speak any English, but they were drywallers from Columbus, Indiana, but they somehow got on that road and when they got out of the van, they left. So I don't know where the van, whoever the record service was, got a van. Anyway. We're waiting on you again.
And me or John?
I'm done.
All right.
We know somebody's got some time taken off theirs.
Somebody's getting shorted here. I'm doing something real quick right here, and then I'll be ready to roll. All right. I just had to run some figures real quick for us. All right. Anybody else? All right, let's move into this. We're 30 minutes behind. Health Department update.
Right.
I bet you're thinking, holy smoke, ain't you?
Somehow she got first on the list.
Yeah.
Well, Tammy, she will put me first because I have a little one day picked up, so I appreciate that. Thank you. Okay. First off, I have a health department or a health board vacancy. This is my first vacancy since I've been as the administrator for 4.5 years now. It's a non-position vacancy. So, had to read some Indiana code, had to get with Bob Houston, and according to Indiana code, which you guys should have gotten your email too, I have to give you, as the executive body of our county, 5 names. Then from those, you appoint someone. You have our board schedule, I guess, of the terms there. Matt Carter is the individual who's leaving. He moved to Florida. So his term is set to expire next year. So this person will serve at least 1 year, and then it'll come back before the Board of Commissioners for the reappointment of another 4-year term. As Indiana code, we have to have 2 physicians, which we do. Dr. Crosdell, whose term is actually up for reappointment, that'll come before the commissioners in January, like we always do. You guys always do your board appointments in January. And then Dr. Busey is our other physician. Also by Indiana code, we cannot have more than 4 people in one political party. As you see there, I currently have 3 Republicans. I've got Missy Applegate to just confirm all that information is correct. My 2 independents are people who have not voted in a primary, so kind of just by obligation independents at this point. So this appointment, we don't need to necessarily worry about what their political party is, because either way, if it's a Republican, I'm still at my limit of 4. If it's a Democrat, I'm well below my limit of 4.
So down here at the bottom, you have, so these are 5 individuals.
So the physicians, I had to give you 1 physician, but it's really hard to contact a physician right now. So I gave you 3 physicians that live in the county. That is basically the only requirement of a health board member, is you have to live in the county and be a U.S. citizen.
So we can appoint another doctor. correct?
You could if you wanted to. Yep.
Okay.
We just have to have a minimum of 2, which we have met that criteria. And then there's other areas like we have we have a nurse. You could do any kind of clinician, a pharmacist, anyone who has a social work background, anyone who has a public health background. So there's lots of different options in that Indiana code that you can pick from. So we kind of have a wide variety of nurse practitioners, pharmacists, physicians, and then someone with a social work background too.
So we're picking 1 person.
You need 1 person to fill Matt Carter's role, like I said, so this will be from 2020 2021, the whole year of 2021.
And
And then it'll be up for
Be from
reappointment.
these 5 people.
From those, well, yeah, 5 to 8 people.
Any one of those 5 we can pick tonight, though. Okay.
Yep.
So I got a question. Have these people been approached and asked if they would serve?
The only people that I have not spoken to are the physicians, like I said, because it's hard. I've left messages for them, but I haven't spoken with them. So, those are the only ones that I haven't directly spoken to, but the other 4 I have. But if you guys want me to, if you want to go the route of one of those 3 physicians, I can always come back to you.
Well, I've talked to only one person, for the rest of it, I talked to everybody else.
Yeah. So.
So we have, by code, we have to have 2, and we have, right now we have 3, including, well,
Dr.
Dr. Rogers is
is
the health
not-
officer, but we've got,
He's not
Dr.
considered part
Busey
of
and
the-
Dr. Crosdale both on there, correct?
Correct, yes.
Okay. Okay.
Right. You need something?
Yeah, I guess we're gonna need something here. I'm open it up here for discussion on here, so I'll tell you my thoughts, and they're just my thoughts. But, and the name is on here, and, but Gene Robbins is on here, and I know most of these people on here, and I can go probably any direction, but I'd probably be more in favor of Gene myself, just for the simple fact that, Gene has always been a big supporter of the health department, Kelly was, and I would probably myself think that I would like to see her on that board myself, but again, that's just my opinion, so it's wide open here for anybody else too, and we can decide.
Did you say they had to be equal representation as far as political parties?
So I cannot have more than 4 of one political party. So if this person's a Republican, that's fine, that puts me at 4. If this person's independent, that puts me at 3. If this person's a Democrat, that puts me at 2. So it's really anybody.
Okay.
Are you phoning a friend for your?
I don't have a friend.
That's easy.
Well, I'm with Bob on that one,
Yeah,
I'd be for Gene.
Jean obviously expressed interest because 1, she's our WIC director here in Scott County. 2, because Kelly was such a supporter of us. Selfishly, I put more females on there than males because it's just me and Sharon right now, so we're
Yeah.
a little male majority, but give it some more diversity. But totally up to you guys.
I had a smart remark, and I better shut up.
That's okay.
Yeah, I don't have a problem with that.
Okay.
Well, you make a motion?
I'll make a motion to put Gene
We'll take
Robbins on the
this,
health board.
open it for a second for Gene. I'll make it unanimous.
Great, I will let Jean know, so that will start January 1.
Okay.
And then again, in January, we'll come and do the reappointments for the
Other,
Lincoln Taylor and or Dr. Presto.
So those are the 2 that are up?
Yes, those will be up. So if the board chooses not to go with Dr. Presto, you will have to reappoint a physician. And then Lincoln is an engineer, so you could, again, do anyone who meets the criteria in the Indiana code to appoint from. So, okay, service agreement. There's been a slight change, really just wording for legality. I've looked at so much Indiana code this last week and a half. I'm so glad I'm not an attorney. Okay, so I talked to Bob Houston, and we're getting some money to assist with vaccine administration from the state, about $40,000. It's just going to be added to our current contract for the community testing grant, so you'll just get a contract.
Amendment?
Yes, an
Okay.
amendment to that contract. The state is obviously wanting us to do vaccines almost every day of the week, whenever it's available for the general public, just to make it more accessible to those who want it. So, I'm sure I could get plenty of volunteers Monday through Friday. The weekends are gonna be a struggle. Personally, like if we work 7 days a week, like that's gonna burn my nurses out, because there's only so many people who can administer the vaccine. So, and we're getting money from the state. So, I would like to do a contract or a service agreement for positions. And we changed the wording today, so it says service agreement for emergency management worker instead of the COVID-19 agreement. Because in Indiana code, as an emergency management disaster law, a disaster can be a public health emergency, and then an emergency management worker can be anyone who's paid full-time, part-time, volunteer, or an employee of an organization, and with that, under the legality of liability. So they would, any function under this chapter or any other activity relating to emergency management is a governmental function. The state, any political subdivision, any other agency, or the state or political subdivision of the state, or except in cases of willful misconduct or gross negligence or bad faith. So unless someone purposely tries to hurt another person, any emergency management worker complying with or reasonably attempting to comply with this chapter or any order or rule adopted under this chapter or under any ordinance relating to blackout or other precautionary measures enacted by any political subdivision of the state is not liable for the death or injury to persons or for damage to property as a result of any such activity. So by calling these people emergency management worker, it gives them a layer of protection. So if something were to happen, they would be protected under this public health emergency that we're in.
So,
Does that mean they'll be protected by the county? Insurance?
They would be protected by Indiana code, because this is Indiana code.
so this would be no longer looked at as a service agreement for COVID-19 assistance, it would be a service agreement for emergency management workers for COVID-19 assistance?
Yes, and so the emergency management worker would be one of the three categories: contact tracer, compliance assistance, or vaccinator. And really, it's that vaccinator piece that we're most worried about when it comes to liability.
But if I'm understanding you, then that agreement should read service agreement for emergency management workers
Yes.
for the COVID-19 assistance, right?
Yes.
Okay,
Yes.
so that would be, follow that, Tammy? The top up there, okay.
Yes, I
Okay.
need to add that couple of this too.
So
Okay.
basically, there's the little carrot right there, and then we did service agreement for emergency management worker for COVID-19 assistance.
Yes, and Bob, to make it more in line with Indiana code for the emergency management worker, he wanted that word in there.
Okay,
Does that make sense?
yeah.
And then under 1, A, B, and C would be the 3 types of emergency management workers this contract would be good for, correct? Okay.
Yes, because when I talked to ISU about it, just the service agreement, they said that they would advise that anyone who signed one would also get malpractice insurance. And I don't think you're gonna have a lot of people who just, a registered nurse on their own isn't gonna just carry malpractice insurance. So, we could go the route of just keeping it as the original way, making people get malpractice insurance. I even thought about maybe even doing like a sign-on bonus of $75 or $100 that would cover that malpractice cost, but, in the grand scheme of things, they are doing it because of a public health emergency. And I think whether it says volunteer or paid as an emergency management worker, they would be not liable unless they were acting in purposely, not in bad faith,
Okay.
so.
As
We-
a, yeah, as a contractual agreement, a
Mhm.
lot of times, we do provide, or do ask for certificates of insurance on people who provide these services, but underneath that code, I don't know that we'd have to do that for
Yeah, I
each
think
one of
it'd be
these.
fine.
Right, which is kind of why we
Why we did
changed
that.
the wording a little bit. Obviously, we are gonna do our due diligence to make sure people have their license if they're a
Licensure.
registered nurse or whatever, yeah. So, and do proper training and that sort of stuff. But, there have been reactions to the vaccine. I mean, people who have had anaphylactic reactions in the UK and, you know, different things like that. So I think anything medical related, we just wanna make sure people are covered, because at the end of the day, these people don't have to come and help us do these clinics, and it really helps out their community, so I think that's why they're gonna want to do it, but, I just don't wanna disservice them in any way either.
So what you're asking is that you're asking possibly to hire someone or?
Well, contract with them, because if you put them on the payroll, I guess H1N1, you actually put people on the payroll, Patty said. And I think with, that involves obviously council and the whole ratifying the payroll and all that. So to keep it a little bit more like, I don't know, simple to
This
me.
is technically an at-need
Yes,
position.
yes.
So when you need somebody and you have somebody, or maybe you've got, have a list of people that you can
Yes.
call and say, hey, I need you today, and they're an at-need employee.
Yes,
And they're technically not an employee, but
Yeah.
an at-need service.
yes, yes.
Okay.
Because like I said, the state is wanting us to be open 7 days a week when we have vaccine available for the public.
I was gonna say it'd be hard to do that with what you're already doing without all more
Exactly.
people.
Exactly.
Are
What?
you gonna have trouble getting enough people?
I don't think so. At least not vaccinators. Now, the other stuff where you have to monitor them for 15 minutes afterwards, hopefully EMS can help us out with that. We already talked to Shannon about that, but hopefully not some of the
So
other stuff.
is this gonna be a situation where these people are, it's gonna be like when you do your flu shots, they're gonna drive through?
Yep.
So they're technically gonna sit in a car for 15 minutes in an area and see if they have a reaction or
Yes.
whatever.
That is how
Then they
we
can
have
drive
it
off.
designed right now.
Okay.
Yes. Yep.
And you say you have people that are, you know, that retired nurses or somebody that
Mhm.
is interested in these,
Yes.
okay.
Yep.
So all you're asking for us is just to approve this service agreement as a structure for those at-need
Right,
contracted
yes.
people. And that, in turn, I know somebody brought up something about insurance. I mean, if they're a contracted person, then we don't cover them, we wouldn't cover them
Correct.
at all.
Correct, yes, so that's what ISU said, and so ISU said if you go with the service agreement, just as a service, then they would advise that we ask for their like malpractice insurance. But if you do it to where it's a service agreement for an emergency management worker, then Bob and I had the conversation about, that really falls under Indiana code and what an emergency management worker is during public health emergency, which is a disaster. So it gives them a level of protection that we
Okay.
didn't have with the original wording.
I'm good with it.
All right, you make a motion?
Second.
Let's make her unanimous.
All right.
Clear as mud.
Yes, exactly.
Do you want
Okay, and
this
then,
signed, is that what you want?
if you guys, I guess,
I'll
give
have it in
me
the
the,
minutes.
okay,
All
yeah,
right,
and then,
that's
cause I'm
fine.
sure we'll have
All right,
plenty,
that's
I'll have to
good.
sign them whenever we
All
get
right.
people. Do you want me to go ahead and talk about the CARES safety funds too?
Yes,
The-
because since we've got Jeff still here and Shannon, that'll work out.
Okay.
That'll work.
So I sent you guys an email, this has been probably a month ago, when the governor announced that $20 million grant opportunity for compliance with COVID, and things like that. Basically, that money has to be expended by the end of the year, but it seems to be more like the CARES money was, where we can go back and ratify payroll if it falls into one of the categories under the,
Actually,
right? Is that what you're talking about?
May-
That's what I have, the
this,
safety.
the state, this is the, pandemic requirements, targeted restrictions for counties with high levels of COVID. Eligible expenses must be incurred and submitted by December 30th. And this would be, and you've got a copy in your packet there,
I've seen
and it's
that.
very restrictive on what it can be used for.
Yes.
And the total is $77,470. It's 10% of the original allotment that we had for the
Yes.
CARES money. Jeff and Shannon and Michelle are really the only three departments. Their departments would be the ones that would really be able to do the public education and the outreach. I think Jeff had an idea about a sign that could maybe be beneficial to your department and.
Okay.
So there's, but again, not knowing, you have to submit basically like a plan, a outlined program,
Yeah, or what you
expenses
did.
that you've already incurred. It's not, there can be possibly a little bit of the payroll.
Mhm.
We could maybe try to submit to get some reimbursement through the health department, since that is part of their job, is to make the public aware of the COVID-19 education and whatnot, so. But we just, as far as I'm concerned, if this board approves that Michelle and EMS and EMA we have permission to coordinate and work on programs and expend the 77,000 some odd dollars, that we just kind of work together and try to submit claims as much as we can to try to get as much of that back. And I don't, yeah. So, and because you guys are over the public assistance request.
Yes.
Yeah, I think I'm good with that.
I'll make a motion to accept it, or give you the authority.
Motion made and seconded, and I'll make it unanimous that we give them authority to them to regroup the to expend of 77,470. How's that?
Okay, yep.
Good?
Perfect. And then as you guys know, we went red today, unfortunately.
Back to, I thought we was going to orange, but.
No, we're back up to
We're
red.
running back the other way.
What the other
Yes,
one?
so
Okay.
then we are in red restrictions now until January 5th,
Okay.
so.
Something totally different. I got a call the other day, and I don't know if this will be part of your work or not, but a guy started basically a junkyard.
Okay,
And you can't see it till the leaves are all gone.
Okay.
And I saw rows and rows that looked like junk cars.
okay,
I notified the sheriff, because that's their job,
yeah,
but I didn't know if there's any health issues you might want to get hold of them about.
sure.
I can,
We,
because I've had this same conversation
You know what I'm
about
talking
cars. No, but I will tell you, talking with Tim, is that if it's trash, locally, he can do something about
Right.
it. If it's a car, you have to call IDEM. So.
Well, and I suspected that, but I thought I'd put her on the
I
trail.
didn't know if there was like trash mixed in with it, or if it's just cars.
Yeah, it's,
You know, I could just tell you I drove by. and
I don't think that's right.
it's,
That,
I think-
our ordinance
I-
is just trash, but I don't know
Well,
about.
here's the deal. There's an ordinance in place here in this county that says that if these cars are not licensed
Yes.
and titled every year or licensed every year, then at that point the sheriff can go in, and I think you've had to do that.
Tagged
They had to
probably
go in
100
and
cars.
tag these vehicles, and they have like 30 days to remove them, or
we
then
can.
we can. And so, yeah, that, I know that's in the ordinance somewhere. I do know.
It's over there, and they know, because I've talked to them about that.
So Jerry taking care of that?
Toby
or-
knows about it.
Okay, Toby knows
because
about it.
Toby knows.
I had a place on 356 like that,
Yeah.
and Tim goes, I can't do anything with it. He goes, I can call IDEM and have them do it, so.
I think he's wrong on that. I think that he would have to go work through the sheriff to do that.
And-
But there is an ordinance that says that they'd have to be licensed.
And I think the sheriff's the first line of.
I think so
on this
too,
thing
yeah.
too. And eventually it ends up with our attorney.
Yes.
But if there's any other health issues over there, you could at least look into it.
Yeah,
Yeah.
Okay.
just shoot me that address.
But I saw, well, I'll have you call Toby, he knows where it's
Okay,
at.
yeah, I can do
But
that.
I saw rows of cars, not just 4 or 5. The ordinance says you can have, I think, up to 3 cars.
Yeah, something like that, yeah.
Yeah,
Yeah.
but, I mean, I
Really
couldn't even tell you, there's rows of them.
Excessive,
But you won't see it except for when the trees are down.
yeah.
And the ordinance is kind of, well, we can talk about that, but,
Okay,
yeah.
So one question for you is, has the vaccine, have we started giving it here in Scott County?
no, we don't plan to get ours until early next year, because we
I
have to
know,
wait.
I've seen on the news the other day that they said Clark, Floyd, and Scott would be the first
Yeah, I
counties
know-
in southern Indiana to receive
Yeah,
it.
now employees who work at the hospital, they've gotten theirs.
Okay,
They've gone to Clark and gotten it, but it's not in Scott County.
okay.
That's
Okay.
just because it's the ultra cold, so it can only be held at places that have the ultra cold freezer. We have to wait for the second vaccine, which is the Moderna, because it is just standard vaccine temperature.
Yeah.
So we already have storage capabilities for that, and so we're thinking early January is what the state's looking at.
Okay. And do you know how many doses actually come into Indiana? There wasn't that many, was it, about 900 or something?
I know that today Dr. Weaver said that they did not get as many as they thought they were
I
going
was
to.
thinking there was only like 900 doses
So,
that come in.
I don't know, but then also Governor Holcomb was saying that there's a place down in Bloomington that is contracted with the Moderna, the second vaccine, to make like 100 million each quarter next year, so assuming when that comes out, there'll be a lot more access, so.
Well, I would certainly like to see somehow this get behind us because it's,
Yeah, I mean, I don't think
people,
the vaccine's like a magical pill, but it's definitely, you know, a good.
well, I
a
think
good
it all goes
tool.
hand in hand, and I never dreamed in my lifetime that I'd see that a small piece of cloth over your mouth and nose would cause as much problems as it has caused, but, you know, nobody thinks that they should be told what to do, and I don't know, it's just everybody to their own opinion, I guess, but if I can help somebody else out in public by wearing a mask, I think that's my job as a human being to try to do that. But a lot of people don't see it that way, so, you know, but that's okay. Now, I know what you.
I was gonna
you
say,
know,
I have issues telling, people get mad at me telling them to do it work at home, like, I just get it 24/7.
Yeah.
Well, I don't have a problem wearing a mask, I just wonder if the mask is helping, because all these people that are wearing masks. and-
You said you were
and
gonna shut
I
up.
I can't do it, because I sit at home and throw crap at the TV, because, if the mask is working, the 6 foot away from somebody's working, and the people that constantly tell me they're doing all that,
Yeah.
that they're getting COVID, so,
Yeah. and-
The mask don't keep, the way I understand it, the mask
but
don't keep
yeah.
you from getting it, it
Yeah.
keeps you from giving it.
My
That's what I understand.
experience is
That's true.
twofold.
So if everybody wore it, it'd be
Somebody does.
okay, see?
but these people, I mean,
Right.
never mind.
My thing is that we get those calls too, like, I haven't been anywhere, I don't know how I got this. And then as you have that conversation with them, it's, well, I did go to my granddaughter's birthday party and I did actually go to, like, all, you know what I mean? So
Yeah.
it's one of those.
All right.
It's not a
Thank you.
big deal to wear.
Thank you.
If I wanna go somewhere, I'll wear it.
Yeah. Thank you guys.
Highway update.
I'm not gonna wear it in a car though, by myself.
Well, no, I'm not either. I'm not either, you know. God.
I see that all the time. Right down the
Guy
road, the
talking.
guy sitting there.
Thank you, Jim.
I hope this isn't an engineer that drove.
Actually, I think Shep threw this, maybe. You asked me to find out about the cost of a more secure gate.
Oh.
Yep, and that's exactly what I've been talking about. So Shep, if you draw this, I get it. I mean, it's exactly what I've been talking about.
So as you can see, he's got $1,600 on it. Now, he delivered this estimate today, and said that Friday, steel prices raised, and Monday, steel prices raised. So unless I tell him yes tomorrow morning, he
Get
will
the check.
not secure this price. So I don't care if you tell him yes tomorrow morning or not, I'm just telling you, in all fairness,
You
that's
have
what
my
it's.
beam down there.
I know, no, not anymore. So, that's your all's pleasure if you wanna.
Do you think they can destroy it, Jeff?
Isn't that basically, and I don't remember, isn't that basically what we put, down on, Thomastown?
Yeah,
And
that is what we put.
Yeah, and they've never been able to take that one out yet, have they? I say that and it'll be gone in the morning, but,
Is that what they're gonna put down? Firehouse?
and,
Firehouse?
but that's what I've been, I think it'd be easier and,
That's the same one Tom Rathers uses. He said they're not tearing them
yeah,
up. He builds them for Tom.
okay. I mean, I think it would be
I do too.
worth it.
And
'Cause
I
I'm-
guess that means that I'm paying for it.
We'll take out of the tree business, out of the tree.
Yeah, I mean, you could, yeah. I mean, seriously.
I don't see that.
It is county highway, right?
I know it is.
Yeah,
I'm just trying to be like Shannon and get out of. Oh, sorry. I didn't say
If
that.
you leave, we're gonna give him a whole bunch.
Okay, so do you wanna make a motion to,
I'll make the motion.
I'll second
Unanimous, how's that?
Just one or two.
Now, I will tell you, that is one. You asked me, or I said I would go to, Mayor Hawkins, but unfortunately, he has been out with COVID.
Mhm.
So I will take him this and hope that they want to do the same, but if they don't, I can't enforce that. So,
You
So,
mean on their side?
I-
yes,
Yeah, yeah.
yes. I
We
mean,
can
they
still
didn't
put it up
go
on our
through,
side.
they didn't, yes, they didn't go through his side yet.
Yeah,
But I am gonna tell him what we've done and ask if they would like to do the same, but I can't enforce him to do
Yeah.
that.
Yes, true.
Okay,
Well, we could put a sign up down there for the people that drive through there that says the gate on the other side is closed.
You may get in, but you won't get out, you
Yeah, but
know?
we-
Kinda like the Hotel
for our
California.
purposes, I think, and you, I think you've already done it, but I think we ought to, not only do you have the stop signs and all that, we ought to have,
yeah, we have
and you've got one out
flood
there already.
ahead.
Let them,
turn
I don't
around,
wanna hear them say, I
drown.
didn't know.
Yeah,
There
well,
ought to be one
they'd
up
just
there
be
that
done.
when we pass this ordinance that says you will be fined, I mean.
oh, okay, so,
Yeah,
here's your copy of that,
got the ordinance.
yeah. Which you brought yours, John, but I got Tammy one too. I would really like to see you guys act on this tonight. I don't want to copy, but literally all you have to do is copy. The state statutes here, their ordinance codes here, their money's here. If you had a different opinion on money, that's fine. But you yourself said a minute ago that if you do not hit the pocket, they're not gonna stop.
I agree 100%.
So for the safety, of everyone, the driver, the people that go help them out, I mean, we've got to do something about charging. So I would hope you would maybe make a motion or something that we could go forward to giving this to Mr. Houston and letting him change the wording and then present it back to you all.
On the
I'll make that
30th For
motion.
January.
I'll second.
Oh,
I've been
Did
wanting
we
this
do
for a long
that?
time,
I
so.
thought we all have another, go ahead, I'm sorry.
she said on the 30th,
Yeah.
so could we do that?
Well, the motion been made, second, I'll make it unanimous. I'm
Okay.
right there, how's that?
We'll proceed in case there's a hang up with this, that it has to be published somehow in
Right,
the paper once.
right.
It may be the January before it's adopted.
Gotcha,
Yeah,
okay.
I'm fine with that.
Me too.
Next is.
Mike made the motion, didn't he? Yeah, I second.
Yeah,
Bob said no.
I said go, I said go, you misunderstood, John, I said go.
Shep and I actually
We're getting along
met,
too good here, we gotta quit this.
yeah. Shep and I met John down at the, right here in front of your name tag, John, at the Pigeon Roost about you all asking how much it would cost to get the tree down. John marked it. I have two estimates, quotes, to just lay it down and us to clean it up is the 14 and the 15. For it to be cleaned up totally would be the 32 that you see on your examples there. I
Okay.
didn't get,
So there's two of them that you're taking down?
no, there's one tree.
So where's,
You have two quotes there, two
okay,
different
oh,
companies.
okay, I see who it is now,
Yeah.
okay. All right,
Yeah.
all right.
So, and again, that would not come out of my budget. Shannon volunteered to pay for that out of his.
Well, he got plenty.
Give me a little loader. I'll get the tree.
So, you can decide what you want to do. We also talked about, getting quotes for tree stumps, removal, but I called Jason Applegate and he has what we can borrow. It would still be the highway having to do it, but he doesn't care if we borrow it. Obviously, if we tear it up, we have to pay to fix it, but, we could do that. John walked over and met with Shep about cleaning out that
Low spot.
low spot there, and so.
But don't grind that one historical.
Yeah, don't.
Well, I
the
know,
brown
when he
one.
said that, I was like, which stump?
Pick the
Yeah.
right one.
Well, it's the one in the, you know where,
Okay,
in the cemetery,
Okay.
yeah.
so, anyway, I don't know if you want to act on this, I don't know what you want.
Well, I'm, you know, that, the tree that I'm thinking of, it's the one I'm thinking about, that big dead tall one right there.
Yes.
If it hits that monument, it's a lot more money than this.
Absolutely.
So, I mean, you know, as far as I'm concerned, I mean, I think we need to get it down, and you know,
And I'm going through.
I'm not, I wouldn't be opposed to just but I'm gonna be opposed to nobody's insurance, cause if it hits that, it's gonna cost a fortune.
And we're past additional appropriations. We can't send anything more up to the state, we're past our deadline. So if there's something that doesn't have a line item that this could pay for out of what's budgeted in 2020 somewhere,
Yeah,
there's
this
no
ain't my
way to.
budget. This is
No,
a
I
Pigeon
know,
Rouge.
but, yeah, so
I
I
guess
don't know
my
where we
question
pay
is,
for it from.
Yeah.
That's the
We,
thing.
didn't we take the money that we were getting from the trucks parking out at the health department and stuff, and we put it in a fund?
That's another issue.
That's another issue.
So,
No money coming in.
And I've called and I've talked to 2 different people and I haven't gotten a call in 2 weeks and I'm gonna get back on them
Well, I'm
about it.
forgiving them a
Is
call
something
saying either
sitting there?
cash up or get rid of your vehicle
And then
off our lot.
I'd
No,
call
I'm
the
for-
wrecker service too. I'd
No,
call.
I'm gonna go against the grain here.
Okay,
They've got we have a contract with them.
yep.
And they
I'd impound them trucks until they
There you go.
pay me.
Good idea.
I'm not, no, don't come get them and not pay us. I'd impound them trucks till they pay
I'd
us.
have Bob Houston call him.
Yeah.
I'm gonna talk to him and tell him because I have talked to them and they said, well, are you invoicing us? I said, this is a rental agreement. You guys say on the such and such day of the month, you'll pay us. It's rental. I don't need to invoice you. Because I thought, okay, this has turned into something else. We're not a billing company here. This is a rental agreement. And they have not sent us one dime.
Yeah, this is-
Which that claim would not be considered urgent, and I'm already doing claims for January
January
6th. So you wouldn't be paying out until
Okay.
2021's
Yeah, I just
budget
didn't-
anyway.
yeah, Okay.
We've
I
got
didn't know
2
when they would
topics
do the
here.
service
Take
if they
your-
were.
Yeah, let's make sure that we put, the attorney on that tomorrow.
Okay.
And, let's,
Yes.
you know,
Yeah, I
let's
gave
get
them
something
2
on that.
weeks to call me
And
back
I'm,
and
but
tell
I'm
me it's
not,
straightened out.
I'm not for taking them off the lot. I'm saying go out there and
I was
and
always, I
secure
saw
them.
steam
until-
coming out your ear.
Yeah, I don't like that business one bit, you know?
Well, they've either gotta obey the contract or.
Yeah,
one or the
yeah.
other.
I mean,
So
they-
anyway, I think that's where we find the money for her, for the tree.
Because it was for the county property
It was
maintenance.
for
Yes,
any
you've got
maintenance
an
that
ordinance
we
to
wanna
cover
do.
that. Yes, sir. Yeah.
So you're for the tree, and do you need to pick which?
I don't care which one
Somebody
does.
goes out there in the middle of the night, and just cuts it down.
Oh, you're saying we gotta pick?
Yeah,
One-
you have to pick.
Well, I
Was going with the cheapest one,
Well,
so.
me too.
I would too, I don't know, is that some of Troy's family?
That's his son.
Oh, okay, and,
Is that the $1,400?
Yeah.
but they're both for the same thing,
The exact same. I made sure to call today and say apples to apples.
So I guess
Just
the
lay
other
the
part of
tree
that
down.
is, once it's on the ground, what are we gonna do with it?
We're gonna clean it up.
Okay.
you all gonna do that part.
Yeah.
And then we can do work later on getting stump grinding and all that, yeah.
Yeah.
Well, yeah, I think we need to go, it's only $100, but I think without any other reason, I think we'll go for a
I
little
need
price.
both of these are insured.
Yes.
I'll make a motion for Roth.
I second that.
I'm not getting unanimous. Get it down before it tears up something, I'd say.
The last thing that I have is, it is time for annual bids to be sent out. So I have it marked here. It takes all 3 signatures. So I will need you the 2 separate tabs there for all 3 to sign. And then Tammy, I'll run in and make a copy, and I'll need you to get that in the paper.
And he does not advertise on the 30th. We have to have this done Friday to do it for the 23rd, and then he's closed for 2 weeks straight. We do not have any publications on the 30th and the
Let me see that before you
Who?
start
bids or
signing that.
whatever, closed both times. Right.
Let me see the date on that
His
front
next
page.
publication would be the 13th of January.
That's the first time it'll go in January on the 13th. And we'll only ever be able to advertise it one time this month. That'll be next Wednesday on the 23rd, and it has to be in on the 18th.
Well, the thing is with these, they get mailed out to the companies that bid. So,
Advertising it one time, so.
or, I mean, if you do 2, they don't have to have it to your office until 4:30 on January 15th. So they would actually still see it twice. That's up to you, but we keep a yearly, and anyone that comes in and wants to put a card for their address, we just put it in that file folder, and then we physically mail out every bid.
Because, and as long as it's the first advertisement, we've got plenty of time then. Because
Yes,
it's only so many days from the first
Yeah.
advertisement that we can't have the
and
meeting,
I'll leave
right?
this with you tonight.
Yeah, okay.
Yeah, so,
Now I'll pass it to John there.
yeah, that's fine.
Anything else?
No, that's all I got.
Well, it's my turn. How's that?
Okay.
First of all, I'm gonna tell that, we went before the council,
Yes.
and,
Sorry.
it was kinda ironic, the word that we was waiting on come down while we was waiting to go before the council. But we did secure $333,000, $333,333, up to.
33.
Up to.
Yeah, up to.
That amount, for next year for, the community crossing grant, and it come down that, for this year, which was $866,372. And, to put this in perspective, since 2016, we received $1 million, 462,000, another $1 million, $983,676, and $866,322, which is, almost $4.5 million that we have received, plus the county council, and I certainly thank them, has put in, about $1.7 million, and that has all been spent on the roads here. Now, with that being said, people don't realize, but I'm going to put the credit where the credit is due, and that's on you. You have done an absolute wonderful job, and I, for one, appreciate that. And I think this county owes you a lot of gratitude and indebtedness to you for what you've done, because, folks, you go to any 92 counties. Now, we all know where the money comes from. It comes from, comes from the state of Indiana. We know that. It's through the, the state, and it's ironic that Jill actually, I'll use the word solicited the county council back a few years ago to start a wheel tax here. And they had the ropes over the limbs out there in the courthouse yard. And and then the state does the same thing. The state puts on a 10-cent a gallon gas tax and a $15 registration fee to every car, and that's okay. The problem was, if we had it done it here in the county, 100% of the money that's paid in the county would come back to the county. Now we get a percentage, right? But regardless, you've done a wonderful job of obtaining that and getting that, and I certainly appreciate it, and I think there's a lot of people out here in the community that thank you for it. Again, that money, we know where it comes from, but it don't get here by itself. I've never seen one of them say, hey, we're gonna send you a check. Somebody's gotta go after it. 92 counties, and I will probably bet my farm on this that there's not another county that's received what we've received.
Haven't
So-
you also helped the cities?
I was getting to that point right there. To say that one more time, you was the one that filled out the grant for the city, and the city received $1 million, the city of Scottsburg. So we got that word the same time. So with that being said, I don't know anybody else that's done that. So I congratulate you, and we thank you for what you've done.
Appreciate it.
So, and just wanted to let that be known, go on the record as telling you that right there tonight. So we do.
I appreciate it too. Also, the grant that you're filling out for next year is, when's the deadline for that?
I actually emailed Katie Adams I gave her about 5 days break after I bothered her when we were gonna hear. And they have not set the deadline, but they are opening it up in January, and it's usually open for 28 days. So, it'll be,
But we secured the money.
yes,
Through
that
the-
was unanimous.
Through the council,
actually,
yes, yeah. Now, if it, up to $333,333, that's like we do every
Yeah,
year.
that's all you.
But yes, that is,
And
they would go
I
along
will
with it.
say it's nicer to walk in and say, I got $1 million, But again, this year was the first year that we ever had to do grants in the amount of $250,000. So there is 6 grants that we actually received to equal that amount. And it's hard when you're doing those to know that that bid amount is gonna be exact. So you have to leave yourself a little wiggle room that if it would go up or go down. So it's nicer to walk in and say, I got $1 million, but with us doing force account work, which is the county doing their own paving, you're gonna get more bang for your buck, but it's harder to get to an exact dollar because I don't wanna mess it up and not get it in.
And I will say this, I'm sorry, John, go ahead.
Am I not wrong, the state initially, before I was around, they'd given a full $1 million. Then they cut it back.
You
and said
matched $1
you have
million.
to- You have to come up,
Yeah,
and
the
that's
first
where-
year, you had to give $1 million to get $1 million.
Yeah.
And they did that.
Then after that, it went to the 333, 333,
and our,
333.
and our councils.
And that's all been hospital funds. That's not
Yeah.
been tax
No.
dollars per se. It's been.
You know, I tell you what, and that's one thing I did say on behalf of the commissioners to the council, and I say this and go on record as saying it here. The council has been good to work with when it comes to these monies. We have, like I say, they have gave us almost $1.7 million to make these matches with. Now, with that being said, I'm gonna tell you that lots of times people reading the paper and they think you just blow money, spend money, but the people of Scott County, they can go back and look. The tax rate has not increased in this county since 2003, was the last tax rate, the property tax rate that went up. That's all been done without raising property taxes. Now, property taxes goes up because of assessment goes up on the property, they can't control that. The assessor down on the end is the state assesses them, so that's where the property taxes goes up. But as far as the council raising the tax rate, it's not happened. So I appreciate everything that they've done, and they've been easy to work with on this money for here and the things that needed to be done. So we do appreciate that. All right, anything on your part?
Thank you.
Thank you.
All right, we'll
Thank
move
you.
right along. The Family and Social Services Administration, state provider agreement for incarcerated offenders.
I'm here on behalf of Sheriff Gooden.
Okay,
And I do want to say that I'm very excited. He called me today and he had been to the physician and he is all clear.
good.
He is
Good.
doing
I'm
well.
glad to hear
So I'm
that.
very glad about that. But this is in order for us to get our Medicaid reimbursements for incarcerated individuals through the Family Services, Family and Social Services Administration, SAA, or FSSA.
Uh-huh.
And this is a contract with the state. And so this was left with me to see if you guys would consider this and approve this contract.
Is this a renewal?
I can't say for sure if it's a renewal, but I think it is because they've actually got the clerk's office down there and it's really my office. But
So is this, I mean, I don't really want to consider something that I've not had a chance to read over here. Is that something that we can do
we
on
might
the
be able to
30th?
do this on the 30th. I mean, if you want to take a look at it, but this is
Has-
between the state's social services agency and this county in order for them to administer with the Medicaid payments. So
Didn't we do this last year?
I
And it may just be a basic renewal right here, I
Yeah.
don't, and
And
again,
if you
but
guys
I'd like
want
to
to
know
table it,
that.
that's fine, because you guys can do this on the 30th.
Okay,
You can look at it again.
and,
I'm ready to go. I'll wait, whatever.
I'd like to read it, because I don't remember seeing this before, but if
That's
it's a
what it may-
renewal, I'm fine. but-
yeah, and it probably is, but I'm not 100% sure on this.
Okay.
So let's plan on that, how's that?
Good enough.
All right. Next up is the group health clause for retirees.
Okay, we have a situation with an elected official who has coverage for himself and his spouse, and he is not going to be serving it come January 1. His spouse is an eligible retiree under our insurance program. Had the spouse taken coverage, individual coverage, and paid the premium upon retirement, but since the family situation was such that there was an elected official that could cover this retiree under a joint plan, so to speak, with the spousal coverage, the coverage has consistently been provided. Coverage for the spouse has never ceased to, is also eligible for retirement benefits. This clause, it would allow for anybody who's never had a lapse in coverage, who is eligible for the retiree benefits under our county rule, which is if you're elected, it's 10 years and over 55 if you are an employee, which the spouse is an employee, the retiree spouse is an employee, 15 years and 55. But not yet Medicare eligible. They can elect county coverage. Well, they've elected it, but it's just been under a coverage through a spouse, so to speak. So this would allow for that person to continue their relationship, the retiree, with the county's group health insurance plan. But if anybody is ever not elected upon retirement, or they discontinue their coverage with the county, or it's severed for any reason at any time, retirees would not be allowed to jump on the plan. So to make this simple, there's never been a lapse in coverage with this person, period, whether it's been individual as an employee or whether it's been through a spouse that they were made covered under. If, say for example, I retired from the county, but I did not elect to take the county's insurance upon my retirement, this clause would say, okay, you can't in 5 years jump back on when your husband retires and takes you off his insurance. You can't jump on because you don't know what my conditions are in 5 years. But this person has never had a minute of not being covered by our insurance carrier. So in order for us to do this, because right now when that official's insurance terminates on the 31st, United Healthcare is saying, well, that link is broken now. But that person is eligible, who is the spouse of this person, for our retirement insurance.
So the
But
role's actually just gonna switch. The retiree that didn't draw because they were on the plan of the other spouse, that spouse is no longer eligible. Now the other one still is because, or could have been because they were a retiree.
And my
And
understanding,
they're in that 10-year,
yes, they got a couple of years before they're Medicare eligible. And they've never had a lapse in coverage. Now, I wouldn't, this clause, like if, say for my example, Larry's 5 years older than me. If I was on Larry's insurance when I retired, and I never took the county's retirement benefit that way, or option, and you pay your own premium. And then he's 5 years old and he jumps on Medicare, and now my insurance is gone through his employer. I can't come on the county's insurance because I severed my coverage with the county because it's been maybe 5 or 6 years since I've been, but this person's never had a lapse. Never had a lapse in coverage. So United Healthcare knows them, they know their medical history, they're in our same risk with the group health that we've got right now. Because you don't know in 5 years if I did that, what my health situation is and why I need insurance for 2 years and try to get on the county's group health plan and pay my own premium. And I could be a bad number, you know what I'm saying? But this person is a known factor.
now I
Does that make
understand,
sense?
yeah, but if I'm getting this correct, it was at night, well, I've been reading this, it doesn't cost us anymore.
No,
Yeah, the county don't have to come up with more money,
And
so it's put, and
yes.
there's always a rate issue, but,
And it's the same participants we've got in the group right now.
yeah.
Otherwise, since the spouse is now the link to the county's insurance, they're saying this person's done. And so I talked with our agent, Emily from Freeman, Will and Niemeyer, and they said if the commissioners would approve this, then they would allow that person who has coverage right now to stay in the county's group health plan, whether the spouse is covered or not, because they do meet the other criteria for retirement. But that's they're paying the premium. We are not paying anything.
Yeah, that's why it ain't costing us anymore.
No.
so this is like the retirement thing that if neither one of these people are on the payroll.
Correct.
So what's gonna happen is they're gonna pay the premium, technically.
That's right.
And if they're gonna fall under the retiree employment that we had before, but in this situation, cause it's kind of a different, that the one spouse retired, the other person, you know, is not eligible for,
Retirement, right.
is not eligible for coverage. So, and neither one, or actually both of them's been in the plan the whole time. I guess this clause then is technically only for those individuals.
That have never, not
Would it ever-
participated since retirement in our healthcare plan.
So the clause could benefit other people down the road if, but it'd be a
Be
really
the same.
strange situation.
It would be a
Well-
very, yeah.
And so what I'm understanding, tell me if I'm wrong here, is at this point, if somebody's spouse, say from one of the offices here, was to be elected to a job, they would be entitled, if they fall under that, they would be entitled to insurance if they are basically a commissioner or councilman, correct? So at that being said, if the person retired from one of these offices, they could be on their insurance. But then when them people was either didn't win or whatever, or decided to not be a elected official, then that person, as long as that coverage don't break, they can go back and pick it up because they're still a retiree, correct?
Yes, and this is
Okay.
a very, very unique situation,
Yeah.
that this clause was actually, because it's basically an amendment to your retirement situation, whenever you outline what the criteria is for retirees that can pay their own premiums. But if that person, say for example, went for 2 years as a retiree and never paid their own premium, they went on their spouse and they worked somewhere else, but then they become an elected official and say they were added back on the county insurance, they would not be able to come back on as a
Yeah.
retiree because they were insured somewhere else at one point in time.
Yeah,
This is only
this-
for
yeah.
continuing coverage.
Yeah, I
Yes.
think I'm okay with that.
It's
I
very
think it's-
limited because, say for example, we have spouses that work here at the county.
Mhm.
So if one of them retires and the other one's working and they stay on the insurance, then if the other one happens to be older and ends up retiring, this person can still keep their insurance as long as they've never separated coverage from the county.
Okay.
Yeah, this is very, no lapse, no lapse.
But back to what I said, it may never happen again.
Yeah, it could not,
Mm-mm.
and then it could.
No, but this very unique
Yeah,
situation that
yeah.
created this thought pattern. Okay.
The only thing I'm gonna say, and I don't have a problem with it, is that, and the reason I don't have a problem with it is that there's never been that lapse. That
Right.
person's always been on the insurance, and there's never been a gap between doing something and not doing something. So if there had been, like you said, 6 months, a year, whatever, and
Anything.
you were out somewhere else, and then that happened, and you said, wait a minute, I want back on that insurance plan, I'd say,
Yeah, we had somebody on the plan all along, so.
Yeah.
Well, you-
it's not gonna cost us
Motion.
anything outside of,
Got it.
if they became a high risk, but, you know,
Well, John's made the motion that we approve this clause for the retirees. Second?
I'll say,
Unanimous.
it's not costing us anything, so.
Yeah. it's not-
You need a couple of these.
Yeah, probably. All right, TM Wells Valuation Services, Huntington, Indiana. What is this?
I know I've been sounding the warning bells about fixed assets and State Board of Accounts, and that's gonna be, and they warned us at our opening for this last audit, that fixed assets are going to be a major focus of State Board of Accounts. This is the service, and I brought this to your all's attention, I think, in a few meetings ago. This Tim Wells Valuation Services has done work at the county before, many years ago. They are an inventory specialist company. They will inventory all of our fixed assets, and our county policy for fixed assets is anything that has a value over $15,000. He will assess, as you can see, as in required by the State Board of Accounts under number 4 there. They will do land, infrastructure, buildings, improvements. They will do machinery and equipment. They will take care of roads, culverts. They will basically go and inventory everything that the county has that's worth over $15,000.
That includes roads, everything
Yeah.
in there.
And the redevelopment commission has appropriated money for this contract payment, should you guys so agree. But the board of commissioners will be the ones that will get written up, and the county as a whole, if we do not have something in the works for fixed assets by the next time the auditors come here.
So this is mandated from the state.
The state will require a fixed asset report, and this company has worked here before, and they will do this service for us, and it's, $70,000.
$70,000. Let me ask you this, is what, how often is this gonna be done? Every year?
You have to maintain the register, and it has, they look at it every year. They no longer will accept your insurance schedules, and they wanna know purchase price. They don't wanna know what it's worth today, they don't wanna, they want to know purchase price. So this is a big, big job that this service will do. So if we don't have any major changes, we can pinch hit a few years and then go back and pay a small amount for an update. So he won't have to come back in. Once he does this, he'll have a good list, and then if we try to update it as best we can with what we've deleted, what we've added, then he might only have to come back every few years and give us an update, and I think that was about 14,000.
It's not to exceed.
Yeah.
The other question is, I guess, two questions. Is this something that is new from the state, or is this something we've done in the past and we just quit doing it?
This fixed asset schedule is nothing new. The state wants to see that every year that they come in, but we know that they have certain things that every so often they crack down on, and this is one of the things. And fixed assets are gonna be their next big focus, because every so many years they try to go sweep through the counties and bring everybody into compliance again, or you get written up.
So the other part of that is, you said the redevelopment corporation is willing to pay some of this?
All of it.
All of it?
Because they have assets, they've got land, there's land up there, and there's,
Okay.
they're in agreement.
I'd say,
That's
It
what it
says
is.
on here that we're gonna make this in payments.
Well, we can,
that's,
right.
okay.
If we
Well,
have,
actually, I liked it. It showed me they're saying if we don't do our job,
yeah, you don't have
but,
to, you're dissatisfied, you
Yeah.
can, but what will be nice is if we have this contract in place, then we can encumber what was appropriated this
Yeah.
year and move it forward and get it paid for and get them working, because then you guys will be in better standing
so
with
do
the
we
state.
have any, and I know you said you've worked with this company before, I mean, is other people using this guy, or this
Yeah,
company?
and what they do actually, they give you a pictorial too. We've got old books here where they did it several years ago, and they actually go and take pictures of your items and give you a photo album of, and today it might be on a thumb drive or something, but they're very thorough and, very professional.
So they're not a fly-by-night?
No, they've been around for years. Matter of
Okay.
fact, I think one of the last times is whenever Iva was auditor, they were there. So that it's been a long time.
Yeah, I think it was, I think I remember using
It's-
this.
it's probably been
back
15
several
years since
we've
they've
done
been
that,
here.
yeah. Well, I'll entertain a motion.
yeah,
So-
I'll make a motion.
I'll second it, since it's paid.
That's, yeah,
You got an
paid.
election sewer plant?
Pardon me?
We own the Lexington sewer plant.
Yeah,
Yeah,
yeah, yeah,
oh, yeah.
yeah.
But that board manages it.
Regional sewer board is,
Manages.
actually manages,
Yeah.
but, and.
Okay. Yeah, sorry.
That's okay. But let me bring you up to date because I was there on that, so I'll let you know that. But yes, we do own that. And we also own what they call a neutrifying reactor system that they, that goes with that, that cost us $250,000. You remember that, Marty? And, that the state of Indiana said that we had to put in, before they would, allow us to get licensed to open that. And, I told them at that point that it would never kick on, and guess how many times it's kicked on since we spent that $250,000?
I'm afraid.
Zero.
Yeah.
But, again,
Still we had to pay.
but we still had to do it, so.
Yeah, I know one of those systems where a guy goes, I go, what's that box out there? He goes, it's got a red light on. He goes, that red light ever comes on, call us.
Yeah.
He goes, it's never came on.
Yeah,
The bulbs burn out.
$250,000 and, yeah,
The bulbs burn out.
yeah. All right, we got a claims consideration payment here from the redevelopment fund. And I guess this is,
Well, no, actually, that big stack right there.
This?
Flip on it. You know how this is December. Okay, you guys, what I wanna tell you we've got in there are funds, for disbursement from redevelopment. That helps Shannon, get one of the ambulances from the CARES fund in there, that he was given by council. That's got $100,000 that the redevelopment approved to the refuge, as part of their community development. There's a lot of, SCEDC has some claims in there that Gene Robbins has submitted that will be paid out of their $33,000 balance fund. You guys peruse that, take your time, look at it. I'm sorry, but that's not one of those lists that we could just send because
Yeah.
this all developed
the
because
grand,
it's December.
the grand total is $478,970.42, excuse me.
But
And
300 and some thousand is just two claims. The
Yeah.
redevelopment
Yes.
400 and
Yeah.
him for,
Yeah.
CARES for 220 some thousand.
Yeah,
Yeah.
so that's,
No, let me make sure what we're doing. I know we did that with development. We're just approving it. What are we doing here?
Those are the $100,000 to be paid to LATCO for the refuge on behalf of them.
So,
And 200 and some thousand out of the CARES fund that council just approved for Shannon to get the other ambulance.
yeah.
And that's the majority of the balance there. And then the rest of them are some odds and end bills Gene had, a few claims that needs to be processed before the year's out. And I'll probably have a short
I
list
wanna
for
make
you on
sure,
the
I
30th.
wanna make sure I know what I'm doing here. This is stuff we've already approved on redevelopment.
Oh, yeah.
And we
It's
have to
just-
approve it here too.
These are everything that's either been budgeted, appropriated, or approved. We're just wanting to make payment.
Yeah,
Yeah.
okay, gotcha. We're not coming up asking that
No,
much
oh, no,
money.
this is
It's
nothing
already
new,
approved,
no.
already been,
This is just sending the money out
it's
the
just
door.
like we can.
Been approved, and like I said, the council approved that on their side, so.
Yeah, that big list you guys get typically every month, this is our mid-December big list.
Well, I know what it is, and I just.
But I wanted to explain the big ticket items in there
Well,
because.
you know, it gets
that's a-
confusing
yeah.
sometimes when you go back and forth from the council or development to the commissioners, who all's supposed to do.
And like you
what.
say, the two of them was, two of the claims total over $300,000, right?
Yeah, yeah.
Now,
It's,
who was it that received most of that money?
Latco Construction, $100,000.
Look at one
for
laughing back there in the
development.
back there. I don't see Bill laughing.
I'm sorry, Shannon,
He's cost us a lot of money.
I'm just asking
You
for.
have no idea, I'm getting ready to.
Oh, no.
And I'm sorry, he just led me right down that rabbit hole.
He sat back there and laughed, couldn't help it.
I'll make a motion.
Motion made by Mike, second.
I'll say.
I'll make it unanimous.
You're done, your honeymoon's over, okay, you're done.
He never had a honeymoon. He eloped.
Oh gosh, and there's one more claim underneath this stack, and again, it's on behalf of Shannon,
Nah.
What?
Here you go.
Yeah, and then it has.
Is that the one I'm looking here for North Central Ambulance?
Yeah, the $10,023.
Yeah. For,
I'll make a motion.
motion made, second.
What is it again before I?
It's
approve it?
$10,023 and it's for that, front grill and UV filter system and, on-spot tar chains and power CO2 lift for a total of $10,023, and that's coming out of the general funds, already been appropriated.
We already got.
Already done, so.
I vote for it.
All
But I would
right,
like to say,
Mike,
you gonna be coming back?
second,
again,
I'll
or-
make it unanimous. John, second.
I mean, this, are we kinda caught up now? I mean,
I'm gonna give you a report in a minute.
huh?
Thank you.
I'm gonna give you a report in a minute.
Okay. He's gonna have a limited time.
Uh,
I'm not gonna be it very long.
Well, we've invested.
All right, what about the payroll ratification here? Your motion,
I'll make a motion.
Second.
unanimous. And consideration of minutes from November 4th regular meeting. Everybody had a chance to look at them,
I'll make a motion.
Second.
unanimous. EMS update.
I actually forgot one thing. Can I come up real quick?
Yeah, I guess you can.
Well, thanks.
Kids, you're already up here.
I told you all I expressed the trucks that we were down, the pickups, the
Yeah.
time, and I spoke wrong about one of them. I said the motor, and it wasn't, it was an air compression. But I also went to the council and asked for money out of the CARES Act before it was all stolen from me. And I will say the county, or the council was generous enough to stop someone from taking it all and gave me 23,000 some odd dollars, which was enough to buy a patcher for a single person that we needed, some chainsaws and pole saws that we had purchased. But the thing that we needed was the pickup truck. So if, which I do, but if I can move some monies, no additionals, but if I can move some monies, would you all agree, we've already been shopping basically, but would you agree to let me go ahead and get that purchased?
Purchase a truck,
Yes,
a new one,
yes,
and you within your budget?
yes. You wanna tell them what kind, or, I mean, it'll haul, it's,
That's 3/4 pound,
Yeah.
4 doors.
And I don't know if you can do this or not, but I hope we buy local, if you can.
we have looked, we have looked. The problem with local is nothing is in stock, and it's gonna be 14 to 16 weeks before you can get it.
Unless, it's just me talking, I'm
Yes.
for you with this.
Yes,
But if we can do it local, even if we have to wait, unless it's some kind of emergency, I would prefer to buy local.
well, I will tell you, one district is driving a van,
This is
and I don't know
machine
what
involved.
kind of work you think we
Yeah,
can do out
I
of,
said,
Well-
Jill, hey, I can get,
It's,
we can work tomorrow, I'll be with you.
for local.
that's who I'm dealing with. That's where you got yours, same place.
Yeah, that's who we went to, but he has, I have an email that he can't get it before.
I've got you that spec sheet, I can tell you what it's for, how much did he tell you?
Well, I
We
think you
don't
all, everybody knows,
understand
I
that
think
yet.
it's not me either, I think everybody agrees here, if we can, I know you can't always do it.
Yeah.
Sometimes
We
things
try
don't
to.
work out the way, but I'd really rather spend local money.
We need to work with, we need to work with.
We try to, but,
I
but we
would-
try
And
to
I've been through it
save.
over there too.
Yeah,
know
I
you
think
can
our
do it.
problem, I think the problem is you're limited to what you got. If
Yeah.
you only got one dealer,
Yes.
it's kinda hard to, see what I'm saying?
But I
think-
did try,
I
John.
think,
I
okay.
did go there first.
Okay.
So I think you always give that shot to them, but it's awful hard when you only got, if you've got,
I
the
know.
only option.
I know everybody gets tired of hearing me say that.
No,
but,
I
Yeah.
don't. We did
I
try
hound Shannon
first.
all the time about it and everybody
Yeah,
else.
no,
really.
I totally agree, and we did
Okay.
try there first, but I guess I just
Uh,
want your permission to.
Yeah,
be-
I don't have a problem with it, you, as long as you got the
Gary,
money,
I
Yeah,
got the money.
okay? So,
I'll make-
you need a motion? Motion?
second.
Second? Unanimous? How's that?
Sorry, I forgot.
Thank you.
Thank you.
Now, EMS update. Come on
Bring all
up.
these baggage up here.
It's a low contract.
Except my time.
Better, son, better. So, Raymond asked me to come up with some core values You guys have that, I had it.
I think I got that.
Yeah.
Yeah, I
There was a spelling error on there, so.
Oh, was there?
Oh, let me check that.
Yeah, do that. My, program didn't.
Yeah, I got that one, yeah.
So those are our core values set up, so we're working towards a commitment to the county and all that kind of stuff.
I can't hear you.
I said we're working on core values for the service. That's what kind of Raymond wants to go with, so we can have these for our SOPs, what we're gonna be driving for. So those 5 of them right there, you guys can see them.
Kind of like a mission statement, isn't it?
It kind of is, yeah.
Yeah.
So just to let you know what's going on. As far as, runs, we're at 4,444 runs for the year. Average is 12.6 runs a day. Average is 6 runs per truck, based on a 350-day rotation. Now, with that said, since I've been there, we've been doing 28 runs a day. So when you guys had your COVID emergency from March until I come on, the run volume was down. Now we were exceeding, I think, where you guys were at this time last year. So our profits are increasing as well. So financially, we're gonna make our budget. We're not gonna be over. We're gonna be right where we need to be,
Good,
even with the 3rd truck.
good. Glad to
All
hear
the stock, we've just invested in some programs to help us with management and accountability. So we have those in place and those are going. The veterans truck is on the road. It is fully functional at this point. We've been making runs at it for the last 7 days. So we have that. We just approved or are going to be approving the 215,000, well, 220,000 or whatever it was. And that's just to go for me to have permission to go to Minnesota, pick up the truck, bring it back. And I'll be going out on Sunday morning to pick it up and drive it back from Lester Pierre, Minnesota. So when we get it back, we get it ready to get in service as soon as we can get it lettered and as soon as we can get the radios in it. It'll go on the streets.
It's not an overnighter, just gonna go right back.
Oh, it'll be an overnight.
Okay.
It's about 13 hours one way. So I was gonna try to scram it into one day, but I don't know. Just kind of depends on.
Well, that,
Yeah, just-
better off
and I've
spending-
got-
I'd be rested up and drive back safely.
Yeah, that's why I'm flying up to Minneapolis and getting it. They're gonna meet me on Sunday morning. I'll sign the paperwork and then come south. You guys have done, well, you done signed the paperwork on it, so you know it's coming. Just let you know. I'll have the title and stuff with me when I come back.
Yeah.
Within the next 2 weeks, I'll be going to Elkhart to pick up the next new truck. We're trading in one of our Fords for that truck. It will be ready by probably around the 28th or the 1st in that week somewhere. So I'll be going up to Elkhart to get that truck probably the first week of January. So that truck will be here and it should be on the road within a couple weeks. Just waiting on the radio guys to come in, put in the radios and get the truck lettered and all that kind of stuff. So just let me know where we stand with that. Redevelopment Committee, I approached them for a total of $653,000. And at tomorrow's meeting, I priced high simply for the fact that we got into some situations to where we actually had the billing department to help pay for part of one of our new programs. That saved us about $30,000. The hospital still hasn't got back with me on that yet, but they're, we can get in contact with Gene to see where we stand at that. So far, I've saved us $84,500 of what we appropriated through redevelopment, which I'm gonna reapproach them about the RTV for snow removal and patient care and outlying areas tomorrow. So with your permission, here's the quote from Jacoby's. It's $19,000 for the RTV. That comes with the snow plow, the winch, and the salt spreader on the back. So we can use it for maintenance and patient care out at the station. So, also what I want to present, and this will come out in the 30th meeting. These are the invoices for the 2 other trucks that we're purchasing. One's a remount, so we can get that chassis, get it up there and get it started after 1st of the year, and then the other check is for the purchase of the Chevy ambulance. I'll be taking up and doing the trade-in. The third paper you got, Bob, is for me to go out of town. So basically, I'm gonna walk to Minnesota, pick the truck up and bring it back. So when you was asking if I'm asking for any more money, no, I'm not. I'm accounting for every dime and every penny.
You're not asking us for more money tomorrow?
Huh?
No,
That's,
No.
it's just, he saved so much of what you already appropriated. He
So
it's
thinks
coming out of
his
what
list
we already
changed.
had, okay.
Yeah.
I saved $84,000,
Yeah, I got you.
so now I just need your okay to go ahead and purchase it.
Okay.
And then I'll go to redevelopment and tell them that we repurposed the money because we saved $84,000.
I'm okay with that.
And you can tell me to shut up if you want to, but you looked at this locally too.
Jacoby's is the only place I went to because they're in Sutterburg and Seymour. We can get parts, everything is readily available. Kubota's
How about up here at houses?
They don't have,
They don't have
they
that.
don't, they don't, yeah,
Matches?
they
Okay.
they don't
All
have,
right.
they don't have a dealership or anything for them.
No,
All
it's
right.
four-wheel drive, it's diesel, it's exactly what we needed for doing what we're gonna be doing with.
Okay.
Moving forward.
The only question I have
Yes,
about
sir.
the Kubota, I know you said, you know,
You gonna see these out there?
aside from the
Yeah.
snow removal and anything like that, is, you said patient,
What we're doing,
removing patients from, say, somebody's out in the field, woods, or whatever. I'm kinda curious about that, because a lot of times fire departments are out there as well. And if you already have a staffing of people on an ambulance, or how are you gonna get the Kubota to a scene? But with what manpower are you gonna get the Kubota to a scene?
that's why me and Kyle respond on most of these kind of calls, and we have pickup trucks now, so we can respond out there.
Well, that's the question I have, because,
Yeah,
you know, a lot of times you're struggling to get an ambulance, and now you're gonna do an ambulance, plus you're gonna go bring a trailer with a Kubota on it. That's the only concern I have, is that
right.
I see that that's not gonna happen, because it's, I've been too many of them where, I mean, hell, I drove my Ranger to a scene and pulled a guy off the railroad track and drove a mile on the railroad track. So, that's the only concern I have. I mean, is the validation of being, you know, using it like that. I understand you wanna do that, but sometimes manpower is gonna kill you from doing that, so.
The other issue that we have is if we do have, like you was talking about, the train striking a car, and it goes down the railroad tracks quite a distance, we really shouldn't be driving pickup trucks down through there. The walking trail around Scottsburg, the KT trail from Henryville to Bloomington, the football games, the cross-country meets, there's a ton of stuff that we can use this thing.
Oh, I know,
for.
Scottsburg Fire Department had one,
Right.
and we utilize it at football games as well. I guess where I was gonna go with that is that, if, we were utilizing it at a football game, then maybe the school, you know, pay some of it, so.
And that's a possibility, I just haven't got
Yeah.
that far, because I'm trying to use this for both schools, especially for the cross-country meets and stuff, so it makes it.
So I understand the use, but
Yeah.
where I come from is the manpower to get it where you need to be getting it at, so.
There are several people got them too. I mean, sheriff's got one. I don't get the same thing you got.
His is actually a little different.
Yeah.
Yeah, I mean, ours was set up, and I actually built that thing that slides in the back, and I don't know if you guys, if you're buying one, or you can utilize that one.
I didn't know you had one, but I've looked at one.
I mean, you can look at it if they still got it there, and if you want it, you can have it, or modify it to fit whatever you wanted, so. But anyway, that's the only question I have.
So we need a motion to allow you to go, just, and again, you're not asking for more money, the money's there. Do I hear a motion?
I'll make it.
Second. Go ask them for it. And then you need,
Permission to go out.
permission to go out of state to pick up a new ambulance, and you're gonna fly to Minneapolis, correct? Now, do you need the county highway to chip in some money for that
I
plane
do.
ticket?
I do. She's got $333,000,
Don't get me.
and she's buying us all Crackle Barrel.
There you go. All right, motion to allow him to go after the ambulance, out of state. John made it.
I'll say.
That's.
And then when I go to Elkhart, I'm actually gonna be meeting with the ambulance billing company.
Uh-huh,
So we're gonna have a meeting, just see how everything's going. They are pitching in quite a bit of money for our new, patient care program that we utilize for our patient cares, stuff. So
What's the
they
name?
will actually,
What's the name of that company?
ambulance billing,
That's,
that's actually the
okay,
name of it.
yeah. Well, I dealt with them, I couldn't remember.
Right, and Jim Freeman was, called me, we talked, he was wanting to know why we were doing that, and basically, we get feedback from the hospitals now. This system is actually an international system, so if we picked you up 20 years ago, and they picked you up in Indianapolis, it'll actually generate your information from today, and it actually goes into your patient care file. So there's another way we can utilize, we can get up-to-date patient care sheets without having to hound the hospitals. Louisville, all the Louisville metro hospitals use it, all the Indianapolis hospitals use it. If there's another service in this area, which are 6 getting ready to come online with it, we can actually get face sheets from them, and any patient care that they've done to that patient automatically loads into our system as well.
And I think they're doing several counties around us, aren't they?
Correct.
I think they're in Washington and, yeah.
Yeah. ESO is something new, and it also goes in line with our supply and accountability stuff. So now we can get rid of 2 or 3 different vendors that we have and go to one primary, so now we can track everything we use from the time we apply it until the time we get it reordered and restocked in the station. So now we have total 100% accountability of every piece of equipment that we use on the trucks. And our fleet servicing and all that stuff will be on there as well. That's all I got.
Speaking of that,
Yep.
and I don't know what happened in the past, but I guess I'm gonna ask about all these new ambulances you're getting and stuff. Do you have a preventive maintenance agreement set up with somebody, or?
So, with that said, I have met with Fire Service of Indianapolis, Jack, and he's worked with you guys at the firehouse before. Been talking to him. I'm supposed to be calling up the manager or the owner of the business. I've talked to Brian. He is a fleet manager for the Indianapolis EMS. We talked for about 2 hours about truck fleet maintenance. I've also talked to Louisville as far as their maintenance is concerned. So yes.
Okay, cause I don't know if we ever had anything in the past, or unless, I mean, or if we just drove until they fell apart.
Drove until you fell apart.
So if we had a service that we can get in, maybe even if it's contractual, where we can say every so many oil changes or whatever, or.
So right now, if we use Fire Service out of Indianapolis, it's gonna be $400 every 3,500 miles. And they're gonna do a complete DOT inspection from the front bumper to the rear bumper, everything in the motor, transmission, and driveline. If I use Wheelease, it's $365, and they'll do a complete DOT inspection from the front bumper to the rear bumper, everything in the driveline. Contacted 2 transmission shops. Both of them are Allison. One's in Greenwood, the other one's in Columbus. Basically, every 5,000 hours is what they require from their Allison transmissions to be serviced. So we can actually set that up and go from there if that's what we want to do.
Okay.
They also switch out, they also repair, and they also put in new Allison
At
transmissions.
a couple $100,000 an ambulance, I mean, it's well worth it.
Your average is 164,000. That one truck was more because it was a specialty built, different. All the boxes, the 3 Osage boxes will all match up. The 2 that will be coming out, the remount truck, which will come out in March, and the new truck that will come out in April because that's the COVID monies truck reimbursement. Both will be 550 Fords, 2-wheel drive, and they'll both have the 7.3 engine there. So we'll have 3 gas engine trucks, plus the 2 gas engined non-transport units, and then we'll have 2 Chevy ambulances, both with 6.6 Duramax and Allison transmission combinations. The only reason why we went with those 2 that were diesel, because the trucks were already built and they're ready to go, and we got quite a bit knocked off because they're demos. But these trucks don't have 5,000 miles on them, so we were lucky to get those trucks.
Well, as like I said, I just wanna, I know
Oh, trust me.
We do it in this courthouse, we don't have a lot of
Oh, trust
preventive
me,
maintenance stuff.
I'm complete,
I'm
100%.
trying to sort out, you said they check it how many miles?
Every 3,500.
3,500. How much was it?
365 from Wheatley's, and it's 400 from Indianapolis.
Okay, and that would be 365 per, if you're going, every one of them. And you drive, I'm just guessing here, you drive
It's
3,500
around
miles. Probably-
$9,000.
It don't probably take you that long to do 3,500 miles, does it?
It depends on what our load is. Usually,
Well, I mean, I'm just sorting out how we're gonna pay for this.
Yeah,
This is
so Wheatley's is looking at right around $9,000.
a year per vehicle,
No, that's everything complete,
okay,
$9,000. So where you're gonna pay for that is where I just put in our new fuel tanks.
yeah.
I'm saving you $15,000, so we just paid for our maintenance facility, or pay for our maintenance bill out of the fuel systems that we just put in.
So with any, I mean, that service, is that an oil change included or, and transmission change? But
Transmission change with the 5,000 hours, they're not gonna do anything until we hit 5,000 hours. Now, it depends on what size transmission. If it's a semi-transmission, it's gonna be way different because it takes more fluid. All this is gonna be synthetic oil 100%. I've done, and that sounds retarded, but I went through viscosity training, learned that Schaefer's oil compared to Mobil 1 compared to Royal Purple, Schaefer's by far outlasts all three oils in the freeze test, in the bearing test, and then in the viscosity test.
If you can do all that for $9,000, I think it's a good investment.
Absolutely.
well, for a motor or transmission or anything
Well, you
like
figure
that?
the new Ford engines are a push rod engine versus the V10s, which was not. The one thing we're gonna have to do on the V10 or the 7.3 engines is we're gonna have to do fuel system cleaning because they do build up carbon a little bit faster, but it's way more inexpensive to do that than it is to have the diesel engines in the truck. Part of the problem is with the diesel engines, these guys don't know how to run a diesel engine truck. And I went to every ambulance fleet that had anything from 5 ambulances to 100, I think Indianapolis said they have 175 on the street. They all went to gas. And now that the V10s are gone, they're praising hallelujah, they're going to the 7.3s. So there's not enough data yet out on the 7.3 engines, but from what they've seen, there's not been any issues. They've not had any
Well,
problems.
I just want a maintenance of some sort, I mean, we don't need to be driving something until it breaks.
No.
It's a $15,000 fix, so.
And with one of our trucks, as soon as I get these trucks in line and on the road, Jill's getting one of our trucks for her maintenance department down there at the highway. So it will be an F-450, it will be four-wheel drive, it's diesel, transmission, hallelujah, praise the Lord. It's a her shop, not mine. I can't wait to get rid of these 6.7s. They're pulling my hair out, I'll be honest. So,
She's gonna bill it back to you, so.
oh, I'm sure I'm gonna get the treat out of it.
All right,
Yeah,
thank
they're
you.
doing a good job.
Thanks.
Yeah, we appreciate what you've done, the short time that you've been there.
Is there a country song about that?
Probably, you know.
Gotta be a train.
Gotta be a train, somebody's gotta get hit.
Mama.
All right, hey, let's set the final, meeting for 2020. Do you think the 30th during the day would be beneficial? Is that what you're recommending?
That's what I'm nudging you guys toward.
Okay, so is that something that looks like it'd be a possibility for you? John, you and Mike, you good with that?
Fine with me.
And I don't
Okay.
care if it's morning or afternoon, does not matter.
What time frame would work better for you guys?
Whatever you guys wanna do, I'm with you.
Come up with something.
What's that? Oh,
I said, just come up with something.
well, you want morning?
Whatever you guys feel like.
I didn't
10 in the
mind.
morning?
10, that sounds good to me, I don't care, it'll work. I'll make it work.
10 a.m. December 30th.
I just do a
And I hope
number.
to have a fairly short agenda. One of the biggest items you guys, as I alluded to before, is gonna be your insurance enrollment for 2021. And maybe a few odds and ends claims. I won't pray not staff like you just had. But anyway, some urgents and stuff like that. If there's something we've just got to get out the door. And then that'll let everybody off the hook for the 31st. Then
Okay,
Happy New Year.
Thank
it
you.
works for me. Mike, anything on your part?
Again, I'm gonna ask Kevin, how you guys doing on your fire station?
And it's a dead standstill right now.
Still waiting for state?
No, it's framed, it's metal, it's ready for concrete and doors.
Okay. All right, well, I haven't seen anything, and I haven't been past there, so I was just kinda curious. All right,
John?
that's all I got.
No, I rambled on enough the first meeting.
Do we need a second on that? No, I'm just kidding you, John.
I'll tell you what.
Like you said, we're getting along too good.
There's a word for that, it starts with a B.
Do you have anything?
No, I'm fine.
Okay, I think I'm good too, so I'll ask for a motion.
Got it.
Motion to adjourn, second. Thank you all, we'll make this unanimous, we'll get out of here, what do you say?
Thank you.
Thanks. Did, you need